I know Dr. Amy is getting ready to leave, but before she leaves, I just have a couple of minutes question for her she can answer our question. Smoking and secondhand smoke are a well-known triggering factor for asthma, but recently the hot button topic is obesity and asthma. Can you elaborate on that?
Yeah, there certainly seems to be a correlation, and we don't know if that's because the children with asthma are more prone to being less active and become obese because of that, or because obesity itself contributes to the severity of their asthma symptoms. Obviously, obese children have more difficulty breathing, and it can also cause obstructive sleep apnea, which can certainly exacerbate symptoms. But we know that there probably is a significant correlation, and then of course, if a child has to be on steroids frequently, that can make that problem even worse.
Okay, thank you. So I know you're getting ready to leave, so thank you so much for being here, offering your insights and expertise. Let's give a big hand for Dr. Amy. Thank you, Dr. Amy. Okay, you have some addition. Okay, let's keep the comments and answers to 2 minutes, since we're coming to the end of the session in 45 minutes, but there are more questions to cover. So Christina, go ahead, and then I'll go to Commissioner Darnell.
So I just had a couple of comments and additions in terms of particulate matter. So I'm not sure if people know what particulate matter is. So particulate matter are either solid particles or liquid droplets that are in a gas. So the gas is air. So they can be solid or they can be liquid. And in terms of research and policy, it's true that air pollution in general, outdoor air pollution, has been going down all across the U.S., which is really great. But in the case of Atlanta, we're still out of compliance with the EPA standards currently for PM and for ozone. So I think in terms of research, it's really important to look more at composition. We started out just looking at particles in total and counting their mass, or how many numbers of them there are. But it's becoming increasingly important to figuring out the actual difference between indoor and outdoor air pollution and what the pollution is actually composed of, because it seems like there are different health effects. And we need to have more studies that are focusing on that. And I think it's easier to do that with the outdoor environment. There's more research in that area because we have outdoor air quality standards that are set by the EPA. There are no current indoor air quality standards, although there are some for occupational health. And so in terms of really cleaning up the indoor environment and really looking more in depth into the parts of indoor air, which are most important to asthma, having more inputs, or maybe even a pressure perhaps for having indoor air quality standards may be something to consider in the future. I don't think that's being addressed at all, but I'm sure it probably has been discussed.
Great, that leads us a great segue to Commissioner Darnell. This question about why do you take up initiatives that no one else does? That way, good, in a good sense, because you're like the change agent. On July 17, 2013, you passed you voted to amend the Fulton County zoning resolution to promote environmental justice and protect environmentally stressed environments. That ordinance was one of the kind in the entire nation. So why, and why?
I think the explanation for the policies which the Board of Commissioners has developed in an area which we refer to as environmental justice. Those policies are based upon both the legal and moral responsibility which we have as a government to protect the health and safety of all people. Therefore, this area which I see you have emphasized in your literature, this area of health disparities represents a major challenge to public institutions. The National Association of Counties has adopted a policy of, and I quote, zero tolerance for health disparities. And the Board of Commissioners has adopted that as a goal, zero. Zero tolerance. It is not acceptable as a matter of policy that certain groups would be sicker than everybody else and die earlier than everybody else. That can be important data in the laboratory, but in government, it is a situation that has to be eliminated. We have to show people who pay taxes that we are moving toward the reduction and the elimination of health disparities. And you have pointed out in your literature that one of the factors affecting the incidence of asthma and asthma mortality, and I have some of the highest asthma mortality rates in District 5 than anywhere in the county. One of the factors affecting asthma mortality among both adults and children, you say ethnic differences in asthma prevalence, morbidity, and mortality are highly correlated with poverty. And it continues on with urban air quality and indoor allergens. To respond directly to Dr. Daywood's question, Board of Commissioners adopted a policy that if a minority or a language community has an environmental stressor within their area, no use permit or no zoning modification involving what health services has defined as an environmental stressor can be approved within 1/2 mile of the property line of that community. The policy is based upon data developed by the Green Law environmental law firm, which was a study called Patterns of Demographics and Pollution, where they studied the 18-county metropolitan area to discover where were the areas that had the highest concentration of environmental stresses in minority and language minority communities. And to our shock and surprise, we found out that of the top 5 counties in the 18-county area, Fulton County had number 1 in the area near Douglas County and the Fulton Industrial Boulevard line, and number 5 located near the quarry on the belt line. So when this data was presented to us showing that we had the highest concentration of hot spots in Fulton County than in any of these 2 areas, top 5, the whole 18-county area, then the environmental justice distance requirements were established. How did it happen? It happened based on public policy. It happened because it has been the land use policy historically in Fulton County and in counties throughout this nation to zone environmental stresses in minority communities. There's a reason why there's the highest concentration of companies on EPA's toxic release inventory list are located on Fulton Industrial Boulevard. There is an explanation. Public policy is what places particulate matter in some areas more than others. So we take the position that if public policy created the situation, then public policy can and will correct it. No, asthma doesn't just run in families. According to this report we received, it runs in decisions by people we elect to make decisions for us. That's where it runs. And one of the strategies that I would like to see the coalition explore, which has been recommended, civic engagement. Civic engagement. Sometimes we might need to come out of the laboratory and deal with the situation of why is it that the average customer in a pharmacy has a third grade education. That's what they did back in the day. If a situation that was social and economic or political was creating a situation that was a life and death situation that was costing people their lives, then the community came together in a church, under a brush arbor or somewhere and said, this guy just stop. They call that civic engagement now. I'd like to see our coalitions organized around what we've heard of here from some of these panelists, some of these external factors, social and economic factors that are creating situations indoors and outdoors where people are dying for no other reason than their ethnic characteristics. I also notice here that there's a gender difference. I never knew that. Females, African American women, that combination, highest number of deaths due to asthma. We're just excited by what we have heard here this morning from these experts. I think it's a fantastic panel. I was trying to take notes, but there was so much good stuff coming out, I couldn't take all the notes. So Mr. Adams, my chief of staff, is here, and I guarantee you he got it all. And my colleagues will tell you on the commission, don't let me hear from the experts. Literacy, health literacy. That's what I'm taking away from here this morning. People in that pharmacy, they don't know. They don't know. You know, it's going to take more than panel discussion. It's going to take more than task forces. We're going to have to organize to demand that our governments be more responsive to the weakest among us. Mr. Johnson said he's had asthma all his life. He knows how to control it. He's an ability to control it. When he goes to the pharmacist, they got to do more than just dispense his medicine. They got to answer some questions. We're working toward that day. And I'm just so encouraged to see, people coming together like this to help us, because we're going to do what we have to do to meet our responsibilities to all the people, even those who have a third grade education.
That's a very great point, Commissioner Darnell. You just don't know that you left the door wide open, because in the next 2 weeks, I believe the Asthma Coalition might come to you with data and ask you to pass policy. So I'm not responsible for that. Sarah Passens, can you talk to us about what is the black box warning? And some of the questions that you've always asked us throughout these past 2 years is, what are the protocols that physicians follow when there's an emergency situation with a pediatric asthma patient? Has it been reviewed? Has it been updated? Why are some kids dying? Are there any trends to improve the protocol? These are the questions you asked, and I know you are the best person to answer them because you've researched more than any of us in this room today.
Sure. With our experience, both of our children were on a medication with a black box warning label, and we were completely unaware of it. We are educated parents. We had educated doctors. We went to one of the largest pharmacies in place, and we were bringing home boxes of medication as preventative meds that had labels on them such as rinse your mouth after use to avoid oral thrush, or this medication will not help during an asthma attack. You see these labels printed out on boxes all the time to tell you to take, with food or on and on. But I've never been given a medication, and this particular medication had never had a sticker placed on a box that said, please read black box warning insert. My doctor never told me there was a black box warning on the medication. The television commercials didn't tell me that when I was sitting in the allergist office. When I questioned the original prescription, what I had seen on TV advertised, I got a general response of, well, the benefits outweigh the risk. Well, for me, today, I cringe, and that to me is just a huge red flag. And any child who is depending on their parent picking up that medication from a pharmacist because their doctor prescribed it, they have a right. I mean, where was my daughter's voice? Where was my son's voice to say, hey mom, did you take out that patient insert, the one that's folded up like 55 times and it's, the size of the US map? Were you able to understand everything that was in there? I mean, we speak about literacy. I think you pretty much have to be pre-med to understand what information is provided. Now, I've read it backwards and forwards since the day my daughter died, and we started on this mission of trying to figure out what happened that night. And I can tell you, there's still times when I pick it up and read it, and I have to Google a word, and that sends me down another path. Well, what did that word mean? What would that look like? Is that what I saw that night? So there is a disconnect between, the black box warning labels on all medications, not just the asthma medications, but when you're taking home a medication that states this can cause anaphylaxis or this can cause a paradoxical bronchospasm, you need to be aware of that. And you need to know as a parent, and so do the nurses in the schools, that the nurses didn't even know that this was a side effect. I didn't know it was a side effect. I didn't know what that meant. I thought it meant an asthma attack. The asthma attack where you give them the nebulizer, the inhalers every 20 minutes. If need be, you go to an ER. So, there is a disconnect there with the black box warning, and when you see those type of warnings, when the doctors who are prescribing them and the pharmacists who are dispensing them, they need to have a conversation with that caregiver explaining this is what you do when you go into an anaphylactic reaction or a paradoxical bronchospasm. You can't wait every 4 hours to give a nebulizer treatment. You're going to need epinephrine. You're going to need to tell the paramedics, this is what's happening to my child. She's having a paradoxical bronchospasm where she's possibly having anaphylaxis. I would like her intubated. I would like her to be given epinephrine. I would like her to be given nebulizer treatments in the ambulance on the way to the hospital. I want other medications given to her. Call the hospital for, protocol. And the EMS in Georgia protocols are very scattered when it comes to pediatric asthma patients. So the care is all over the board. I've heard stories in the last 2.5 years of patients showing up in an ER just like my daughter did with nothing but oxygen and a ride. I've heard of stories where children were given epinephrine, bronchodilators in the oxygen, back valve mask, intubated, and were admitted for a day or two and went home. And that level of care really goes back to what we were saying with the whole 911 program, the 911 asthma action plan. A parent needs to know, what can I do to help my child survive this, paradoxical bronchospasm or anaphylactic reaction? And there needs to be a checklist for side effects of the medications. Never did any of my physicians, whether it was the pediatrician or the asthma allergy doctor, nobody ever said, here's the list of side effects from this medication, check off which ones you're seeing in your child. Whether it's headaches, joint pains, frequent upper respiratory infections. And yes, how many times have you, since you were here last, have you gone to your pediatrician or to an urgent care because it was a Saturday evening with that side effect of an upper respiratory infection? So there is a huge disconnect there, and I think they can all kind of be tied together with just some conversations and some better tracking and some better protocols in place for that 911 plan.
Thank you, Sarah. These are some unanswered questions, but I'm hoping that the treatment committee, the coalition, can look at it and improve the standards and make sure the protocol is updated so we can improve the ultimate outcomes of families. Lenny, so how do we foster and improve relationships with your agency and partnerships?
So one of the things that I do at the Atlanta Housing Authority, I manage the data sharing agreements with various partners. One thing I do want to mention that has not been mentioned on the panel, housing authorities, they have to comply with the HIPAA rules. And the HIPAA rules specify that authorities cannot collect health information from residents. The best thing we can do, and we have to be also careful, is we can collect health information at the aggregate level, but not at the individual level. So I just wanted to point that out, that there is a challenge with data sharing agreements, especially health information, because of the confidentiality. Certainly if the family signs a release giving permission to give their health information, that's fine. But authorities really do not collect health information. So what we have done is right now we're going through a data sharing process with Fuqua Center of Psychiatry at Emory University. They're very reputable. They are at Wesley Woods. They are nurse practitioners that actually go inside our HA owned communities. We have 11, and they do a mental evaluation and other forms of evaluation of residents. So we are going through this data sharing agreement with Fuqua, Emory University, but we can only get aggregate information, and certainly we don't have the need